Good evening and welcome to Bronx Talk. If you live in New York City, whether in the Bronx or any of the 5 boroughs, it's hard not to miss homeless people who are on our streets, on our subways, and essentially anywhere that they can find a place to stop. Last fall, the Coalition for the Homeless said there were more than 92,000 homeless people in New York City. Compounding the problem is that estimates say that as many as 2/3 of those have some measure of mental health needs. About 17% of them, or more than 15,000, have severe mental illness. And while the city has been removing many homeless people from the subways and forcing them into hospitals, there are concerns that a large percentage of those are back on the streets without having their issues properly addressed. So let's go one step further. Outside of homelessness, many people have mental instability that require ongoing treatment. So that's our universe tonight and our subject tonight. We're dealing with and treating mental health issues in the Bronx. We have 2 wonderful experts with us. Please join me in welcoming in the studio the Chief Program Officer of Community Support and Outpatient Programs of a social service organization called The Bridge. It is Sheryl Silver. Ms. Silver, nice to have you.
Thank you for having me.
Thank you for joining us. And on Skype, the Executive Director of Mosaic Mental Health. She's been with us. She told me, she reminded me a few times before, it is Donna Demetri Freedman. Dr. Freedman, is she there? There she is. Nice to see you again,
Yes.
Dr. Freedman.
Thank you so much. Happy to be here.
Great. Let's just get right to it. This is something that people all know about. They see people in the street. Many have their own individual problems. And let's get our arms around where we're at. Ms. Silver, let's talk about the Bridge. The Bridge, as I have learned, provides its services to mentally unstable homeless people. You have a range of programs. Give us a little background about the Bridge and what it is that you do in this context.
Sure. The Bridge started close to 70 years ago in a response to deinstitutionalization. So folks coming out of psychiatric hospitals who really had no place to go. So our first programs were providing residences to these individuals. Now we have services throughout the Brooklyn, the Bronx, and Manhattan. We house over 1,500 people, over 600 in the Bronx alone.
Right.
We also have community programs, community-based programs. We have 9 ACT teams. We have an IMT team. We have 4 SOS teams.
Yeah, I'll put up some of those numbers, but what is the secret to success? Now you say, maybe, I don't even know what it was like in the 50s when you were trying to build, put them in housing. I know now it's a very difficult issue, but what's the secret? What's the secret sauce that makes the Bridge work and able to survive in this very, very difficult climate to provide these very important social services?
I think we look for the right kind of staff to work with folks who really need support and really need to be seen and heard as individuals. There's no one fix for everybody. And so we look at that person in front of us and make a determination with their involvement as to what we can do to help them reach their goals, which ultimately will be a success for everybody.
Even just getting them to a point of stability.
Absolutely.
Which, again, listen, we've talked about homelessness here before, and everybody knows it's a combination of so many different factors that cause it. We do have a full page to show some of the numbers that you were talking about. So there's housing for 620 people. And where are those? Where is that housing? In a range of places?
The 620 people are housed throughout the Bronx. We have both scattered site and single site units for individuals. Those who are in scattered site units are individuals who may not need as much support. So they have a case manager who would come to see them about twice a month just to check in to make sure they're doing okay. They may also receive other services. Then we have individuals who are living in single site buildings where they have staff on site who are working with them on a day-to-day basis, some monitoring their medication, ensuring that they're getting to appointments.
I have to say I'm smiling because as opposed to what I read in the Times is that, the hospitals were just putting them back out on the street. Nice to know somebody somewhere is addressing some of these needs. Let's get some of these other numbers up there. Now, what are the ACT teams? There are 408 people in 6 ACT teams. What are those teams?
Yeah, so ACT teams, we have 6 ACT teams in the Bronx and 3 in Manhattan. ACT is assertive community treatment. We like to equate that to a clinic on wheels. So these are teams of psychiatrists, nurses
who go
out to see people wherever they may be.
You know, everything you say, I want to check mark and say thank you, because this is just so necessary. 250 people in care coordination, and you recently were awarded a new program funded by the State Office of Mental Health to serve 110 people transitioning from inpatient care to the community. Last question before we bring Dr. Freedman in. How do you get them in? Is it referrals? Do they, hello, I need help? I mean, how do people get to you?
It's a combination. Some is referrals through the city. We get referrals through local hospitals. And, you know, we've been around for a long time. There's many of us who have been doing this work in the Bronx for quite a few years. And so we might get a phone call from someone saying, hey, we have this person. What can we do? What kind of services can we get for them? And even if we're not able to provide them, we'll make sure that we make a connection to another provider.
Is there space for more? I mean, you say we're housing, 620 people. The need is, I'm sure, much larger than that. Are we at that point where we can say, hey, sure, come on?
We're always looking for more opportunities to serve this population. Wow. There's always more need.
The attitude is there. The professionalism and efficiency is there. It's wonderful. Dr. Freedman, nice to have you with us once again. What are you and your therapists finding with patients who come into the Mosaic Mental Health Center? What are they saying?
Sure.
What are the issues?
I mean, one of the things I think that's really important for us to talk about today is how the pandemic affected people's stability with regard to their finances, their housing, their mental health, and their physical health. And all of those things have been impacted. And as a result, we're seeing people who, are finally getting back to the doctor. They are finally able to reconnect in ways that they hadn't. I would say one of the greatest impacts that is contributing to all of this is the economic impact that COVID had on our society in general. And, housing programs have been around for a long time. We have them as well. They're wonderful. Our staff is amazing. We don't have enough of them, but Governor Hochul has made it a priority to offer agencies like the Bridge and Mosaic and others to apply for expansion in this area. And I think that is a really important step. There's a process around being eligible. So just because someone comes in and says, I lost my job, I've lost my housing, it doesn't mean that we can automatically slot them into our housing programs. There's a process that takes a while and they have to qualify. So we are hoping and looking to streamline some of those. And the SOS program that was referred to is a critical time intervention where the staff is trained to really understand what the needs of these folks are and work with them intensively. Okay. I think when the public sees what's going on, they immediately think negative things about the mentally ill.
Of course, but the people you're dealing with who were affected by the pandemic are, frankly, and for want of a better term, everyday people who just lead normal lives. And what really I think is very interesting is because, of course, the evaluation of the economy and all those other things are general things that we hear about, through government and other agencies. And they say, well, the economy is rebounding, but they don't really talk about the individuals who are still saying, well, wait a minute, I lost my job. Whatever it was that didn't happen at that time. Maybe I lost a family member. Maybe maybe the person who was the wage earner in the family was lost, and that of course created havoc. And then they don't realize it's people are like saying, "What do I do?" So you can clearly see a line beginning in 2020 and then, of course, till 2022, let's say, of what people used to say and then what they're dealing with now. You clearly see that because that was your first answer when I asked you the question.
Yes.
Wow.
Yes, I do. And I think that it is not unusual to see an impact that will last for a long time. You know, we have, you know, even with all of these great new requests for proposals, those processes take a while. So we're going to see the homelessness is not going to immediately go away. We are doing a lot to address it,
Right.
but it's going to take a while.
In the dialogue that you and I had before the program, just to get ourselves set up, it was really important to you that people don't lump all people with mental health issues into a category and use that phrase, well, they're mentally ill or whatever. So maybe you could expand on that, and then we'll ask Ms. Silver to talk about, you know, the kind of that stigma and how that affects what they have to do, which is maybe even more stigmatized because people are homeless or have those kinds of issues. But really, just talk to me about your concerns in that realm.
Sure. I mean, it's a really important conversation because we have for a very long time lumped the notion of mental illness as one category that is a catch-all. And the reality is it's a continuum of the human condition. And if ever that was proven to be true was when this whole world was faced with the pandemic, that people, you know, all over were impacted, that people struggled with anxiety and depression and substance use disorders. People with chronic mental illness is a subset of that larger group, and they tend to have more biologically grounded mental health disorders that emerge in their either as children or early teens, early adulthood. And within that group, there's a very small percentage who show signs of aggression and violence. And what I was really referring to is that whenever there's an incident in our country, when we have violence involved, the immediate finger gets pointed at the person's mental health.
They right away say, oh, he's mentally ill, and so therefore, and in many cases, let's be honest, there was something that didn't happen for them to support that issue. I do want to ask Ms. Silver about it. What are your thoughts about it? And one thing I do want, we're going to get into is that it turns out that homeless people with mental health issues, the stats do show that they are more likely to be victims than be the ones to hurt others. Of course, we know what gets in the newspapers. It's, you know, when they commit a crime and then all of a sudden, just what Dr. Freedman was saying, everybody who's mentally ill has got a problem. But what's your take on what you're hearing?
Yeah, that's absolutely what we see. And we approach people with the question, not what's wrong with you, but what happened to you. And when our staff are able,
I'm sorry.
When our staff are able to do that, it's a real game changer because then we can understand the person in front of us as an individual. It's not one size fits all. It's different for each person. And I think that that's why the state is really thinking creatively about ways to fund new and different programs. In addition to the new SOS programs, we were recently just awarded this critical time intervention program, specifically working with individuals who are leaving the hospital. We're partnered in the Bronx with Bronx Care, which we're very excited about. We have a great relationship with them. So we'll be embedding our community-based staff into their hospital to connect with individuals from the unit to almost literally handhold them to the next step when they leave.
I'm trying to just sort out the kind of the chronology. So somebody maybe gets taken off the subway and they're remanded to a medical facility or some other facility. And at least according to what the Times reported and the numbers show, that maybe even 15 minutes, they just, okay, we saw you and now you get back out. And then at that point, you get a hold of them, or maybe they're referred to you, or they come by. I mean,
Well, if they're fortunate enough for this program to be hospitalized at Bronx Care,
okay.
right? So, and what we really saw during the pandemic is the need for the community-based organizations throughout the city to work more closely together. We had to develop relationships, and we've done that. So if our colleagues at BronxWorks call us and say, hey, this person that was homeless that we've been working with is now at Bronx Care on the inpatient unit, they've been back and forth, what can you do to help? We can push in one of our new CTI teams, and we can connect with that individual to provide them with more intensive support around their transition from the hospital back to wherever they're going.
You know, it's reassuring, frankly, that this exists. I do want to just point out, and to back up what the assertion was before, of the 130 cases of violence by mentally ill homeless people, a New York Times examination identified 94 of those 130 in which breakdowns of the social safety net preceded the violence. So it's like we had them, we took them out of the subways to get them care, and yet, of course, the systems put into place weren't as efficient as what you were just talking about. What would it take? Is it funding? I mean, a commitment from government? Is it, I don't.
Well, I think specifically for this critical time intervention program that was recently funded, and they're funding additional teams, there was a gap identified that when individuals transition from one thing or one place to the next, that's usually where we lose them. So this new initiative is to make sure that at least for the people who get hospitalized at these specific hospitals, that we're able to work with them to bridge that gap.
To just connect you with Dr. Freedman, she was talking about economics after the pandemic as being a leading cause of problems that people break down because they have very important things. I realize you deal with homelessness, economics is a big thing, but did you find a line in the sand, so to speak, during the pandemic that things kind of changed?
I would say we're seeing a greater variety of individuals who are homeless, people who had lives, fully functioning careers prior to the pandemic. Possibly substances got in the way as a result of some pretty significant trauma. Yeah.
Right. Well, I guess we'll start with Dr. Freedman with this, and then I'll ask you the same thing. Dr. Freedman, success stories? Are they, we're talking about all this terrible stuff. Although, certainly from the bridge, we've heard that, they're able to really move people around. But do you find success stories, and what contributes to those success stories? We want to duplicate that or triplicate that.
Well, first I want to say that the critical time intervention programs are phenomenal. We, as part of the investment that the state made during a period about 5 years before the pandemic, that 5-year period, we were part of a project with CTI and were a demonstration to show how much it works. Our medical director, Dr. Alan Felix, was one of the people who developed critical time intervention, and we believe in it wholeheartedly. So bravo to the bridge. And also I would say that please let's connect, because we have a crisis support residence that can take those people who are coming out of Bronx Care, who are getting critical time intervention, but might need to be housed intermittently while they're getting some intensive care. And that is a program that we have, and there are others, and we are expanding them. So the reality is that the continuum of care is there. It needs to be expanded. I wish that the timing of having these things unfold could be faster, but that's the way of the world. And I think, we are making a lot of progress, and we need more of it.
Of course. And what, again, just go back to success stories. You have
So
give us one, make us feel good.
Yeah. So I'll tell you what. A woman came into our crisis respite. I happened to be there that day. It was actually her birthday, but sadly she had a son who she lost to cancer, and she was in crisis. And rather than be hospitalized, she came and was with us. And what she said to me was that it was the best night's sleep she thinks she's had in her whole life.
Oh my goodness!
She felt
that is relieving, but it is very sad to even think.
It's heart-wrenching.
Yes,
but it was the beginning for her of a journey, I think, that many people go on when they finally land in a place where they feel seen. And I think what we were talking about earlier about every individual, to those of us who provide these services, is just that. They are an individual human being, and we want to know their story, and we want to help them individually. And she couldn't have thanked me more. We talked about her going on to work in one of the respites as
That's
a
great.
peer counselor. So there's a lot of great positive stuff happening out there. We just need more of it. We also need young people to want to come into our field. People got really burned out during the pandemic.
You know, I'm going to certainly ask Ms. Silver the same thing, but when we see people on the subway and we say this person is not right, and many people might be appropriately frightened or move away and all those kinds of things, but I'd like to think they have a sense of compassion for that person and they'd like to help. What do you do? I mean, do you pick up the phone? Do you call, hello, Dr. Freedman, I got somebody on the train. Do you call the police? I mean, is that where we're going? I personally have been on the subway or been in the street and said, I would love to help this person.
Yeah, I mean, for example, the program that is at the bridge, the SOS program, we are trying to decriminalize and take away that police. We have a 988 is a phone number that you can call versus 911, and you could call them and say there's somebody in the subway at 14th and I'm concerned about them. It's really, really hot. Can somebody send a team?
Wow.
I think the more compassion we have for our fellow human in thinking about this, not as they're not criminals, they're human beings who are struggling.
I think that makes sense. Ms. Silver, so I don't want to say where it is, but I've seen the same man sleeping in the same part, and he's there. I'm not there 24 hours a day, but I see him all the time. That's where he lives. He's got all his stuff all around him and all that stuff. It's actually in a very visible place. Is there anything to do with somebody like that to try and help them? Or are we just saying, well, he seems comfortable, that's where he lives?
So there are some people who call our agencies directly and ask us for, can you send somebody here, or can you tell us who to call or whatnot? But we also do encourage people to call 311.
I was going to ask if the
311. Yep, 311 is who dispatches both the above ground and below ground outreach programs that are throughout New York City. Mm-hmm. And this way they can also track the referrals to ensure that someone is connecting with them. So we do encourage those who don't have a connection to a particular agency to call 311.
I was reading some of the reports about the police and all those kinds of things. They put this this spit protector. The police do that, and I understand from the police point of view because the people don't know what to do. They're handcuffed, and then they start spitting. But do those kinds of things exacerbate the problem, make it kind of worse? I mean, and is that a bad tactic to use? I mean, I've been reading about it, and people say, well, you shouldn't use it. On the other hand, the officials who are dealing with these people are saying, hey, look, we got to be practed also.
Yeah, I mean, I think that's part of why we encourage people when they do call 911 to always be very clear that it's a person who is acting in a way that seems like they have a mental health diagnosis. Oftentimes, we'll get response from police who have had special training, which makes a world of difference. And
you think that in 70 years, you've noticed that the training does help?
Yes, the training absolutely does help when it happens, yes.
Dr. Freedman, let's start wrapping it up. Let's just talk about Mosaic Mental Health as an institution. in terms of, so you work with individuals? Do you do group sessions? And then kind of, how do you? I'm trying to get my vision on the universe of mental support, mental health support. What do you guys do, and how do you apportion your organization?
Sure. So we have a continuum of care, despite the fact that we're relatively small. We serve children and adolescents, adults. We see people in families. We see people in groups. We work with very young children as well. And we also have housing. We have a range of different housing programs that really depend on the needs of the individual. Someone might need to be visited every week, others once a month. And we have our crisis support respite, where people can come for up to 28 days in lieu of hospitalization, post-hospitalization, when they're in a psychiatric crisis.
Right.
And we also have a vocational program. Lots of people working who have a mental health diagnosis.
And so then the bottom line from you, do they go to your website, presumably? Is there a phone number to call, or you want to give an address?
Yes.
I mean, we've got the website up there.
They are mosaicmh.org, or you can call us. The number is 718-796-5300. And we are here to help members of the Bronx. And we've been here again, also since 1959, when the deinstitutionalization started.
This is what we just heard also from Ms. Silver. Same thing for you. You're looking at the universe. You talked about Manhattan, Brooklyn, and the Bronx, and when you're dealing with this population, that's a lot of people who could use these services. You're still able to deal with individuals?
Absolutely. It's the key. It's the secret sauce. That's the only way a change will happen, is based on relationships that our staff are able to develop with the folks they're working with.
And let's do the same thing for you. People who want to contact you, they go to the website, presumably.
Yep. Our website, our phone number is listed there. We're available. If we can't help, we will find someone who can.
Great. Listen, you guys are great. There's so much more to talk about. There are so many other issues involved here, but at least we touched the surface of it. Sheryl Silver, the Chief Program Officer of Community Support and Outpatient Programs at The Bridge. It's a long title, but thank you so much for everything that you do. And Dr. Donna Demetri Freedman, the Executive Director for Mosaic Mental Health. Thank you. Let's have compassion for people. Let's not throw them all into one box. And let's work with great organizations to try to get them served and to do better in life like we all want to. So we thank you both. We also need to thank our producer is Rebecca Hemick, our director Will Guzman. The editor is Yenelsida Diaz. She's not seen here, but she's doing the job. Cast of thousands around us in the studio, of course. And if the curtain don't fall and the creek don't rise, I'll be back next week. Good night.